Welcome to our comprehensive online review of dental materials, designed specifically for your upcoming exams. Whether you're preparing for board exams or just aiming to strengthen your foundational knowledge, this course will provide you with the insights and key details you need to excel. We'll cover the essentials of dental materials, helping you understand their properties, uses, and practical applications. Stay engaged, ask questions, and use this review as a stepping stone to your success in the dental field. Let's get started and set you on the path to acing your exams. Overview of dental materials. Dentists and engineers have similar long-range objectives in their professions, that is, to design, construct, apply, and evaluate devices or structures of materials that can be subjected to a wide range of environmental conditions. Dental materials may be fabricated using any of the four classes of materials: metals, ceramics, polymers, or composites. From the viewpoint of intended applications, they are classified as preventive dental materials, restorative dental materials, auxiliary dental materials. Preventive dental materials usually include polymer-based mate, riles that seal susceptible surfaces of the tooth, such as pits and fissures, against caries, and/or release fluoride or other therapeutic agents to prevent or inhibit the progression of tooth decay or dental caries. Restorative dental materials consist of synthetic components that are used to repair or replace tooth structure. They are grouped by composition, specific function, the type of tooth structure they are replacing, or method of fabrication. There are three classifications of restorative dental materials: direct restorative materials, indirect restorative materials, temporary restorative materials. Direct restorative materials are a group of materials placed directly into a designed tooth preparation that go through a phase transformation from a flowable or moldable state to a functional solid state while they are being adapted to the preparation. Pure gold in foil form, for example, can be used to make dental restorations or tooth fillings directly on the teeth, but this technique is rarely used today. Amalgam alloy is a metallic powder containing silver, tin, and copper, which generates a condensable moldable mixture that allows placement and carving at the intraoral temperature within a reasonable working time when mixed with mercury. Glass or ceramic particles of different sizes, micron to nano, shapes and compositions are incorporated into a variety of liquid monomers to generate the so-called resin-based composite materials. Indirect restorative materials are used in dentistry to fabricate restorations outside the mouth, typically in a dental laboratory, and then bonded or cemented to the teeth. These materials are used for larger restorations where direct materials, those applied directly to the tooth in the mouth, may not provide the necessary strength, durability, or aesthetics. Metal-based restorations. Gold alloys, highly durable, biocompatible, and have excellent long-term performance. They are used in crowns, inlays, and onlays. Base metal alloys: nickel chromium, cobalt chromium. Less expensive than gold alloys, they provide strength and durability, especially for long-span bridges and partial dentures. Next type of indirect materials is ceramics. Ceramics. Porcelain feldspathic ceramics, known for its excellent aesthetics, used for veneers, crowns, and bridges. Lithium disilicate max, a glass ceramic that offers a balance of strength and aesthetics, commonly used for anterior and posterior crowns. Zirconia, very strong and durable, with improving aesthetics. It is often used in crowns, bridges, and implant restorations. Next type of indirect restoration is composite resin. Indirect composite restorations are less common than ceramic or metal restorations. These are made of reinforced resin that can be processed outside the mouth for better control over the final result, then bonded to the tooth. Then we have the hybrid materials. Ceramic resin hybrids combine the strength of ceramics with the flexibility of resin. These materials are used to balance aesthetics, wear resistance, and biocompatibility. Last classification is the temporary restorative materials. Temporary restorative materials, also known as provisional. Restorative materials are products used for dental restorations that are not intended for moderate or long-term applications. There you have it, the three types of restorative dental materials. The last classification will be the auxiliary materials. Auxiliary, several different substances are needed to fabricate dental prostheses, appliances, and direct restorations. Among these are impression-making materials, gypsum cast materials to make dies, dental waxes to make wax patterns, investments for metal casting, finishing and polishing abrasives for shaping and aesthetics, acid etching solutions for enhancing bonding of direct restorations, acrylic resins used to make customized impressions and bleaching trays. That's the three classifications of dental materials. Challenges of dental materials in the oral cavity. 1. Retention of restorations. Retention, that is, the action of absorbing and continuing to hold a substance or material. Enamel and dentin, for instance, are two different biological materials held together by a graded interface varying smoothly between the two adherent phases. The early approach was to remove the tooth structure, mainly to provide a location for macromechanical retention and create resistance to dislodgement of the restorations. 2. Restoration longevity in terms of mechanical integrity. From both a patient's and a clinician's perspective, a restoration should last a lifetime. Although some materials are expected to last more than a lifetime, in a real-world scenario, the longevity of restorations is shorter than expected, especially for direct restorations. 3. Aesthetic appearance. Another important objective of dentistry is to restore or improve aesthetics, the color and appearance of natural dentition, such as teeth bleaching with whitening agents. 4. Safety of dental materials. Standards for dental materials have been developed to aid producers, users, and consumers in the evaluation of the safety and effectiveness of dental products. 5. Capability of initiating tissue repair or regeneration. Although restorative dental materials primarily focus on replacing missing tooth structure or missing teeth with synthetic materials, evidence shows that certain materials have triggered healing or repair of tooth structure. For example, fluoride ions released in slightly acidic conditions, along with calcium phosphate, can promote the formation of hydroxyapatite within demineralized enamel matrix or become incorporated into the crystal lattice as fluorapatite, resulting in a lower solubility of enamel. As we wrap up this session, remember that mastering dental materials is crucial for your success in exams and in practice. Now is the time to reinforce your knowledge and take that extra step toward confidence. Don't wait, download our study guide, test your understanding with our practice quizzes, and revisit key concepts. Your future in dentistry starts here, and every bit of preparation counts. Take action now, and let's get you exam ready. Great job completing this part of the review. Stay tuned for the continuation of our lecture on dental materials, where we'll dive even deeper into the essential topics you need to know for your exams. Keep the momentum going, and see you in the next session as we continue to build your expertise. Stay focused, and let's keep moving forward together.